2 weeks ago, I suffered from an unusual event of nosebleeding. I was doing some household chores on that Saturday evening, and all of a sudden, I saw my nose was bleeding. It was really scary, and whenever I was trying to spit, also, I was also getting blood cough. So the first thing that I did was to check my blood pressure because I knew that unusually high blood pressure can lead to nose bleeding and can potentially lead to a bleeding stroke because my mother had such kind of history. So the first thing I checked was my blood pressure. Usually my blood pressure remained low, and that time also my blood pressure was only 110 by 75, which is low to normal. So I checked it at least twice in order to rule out any kind of problem. The bleeding stopped after some time, but again on the next morning I saw that the nose was bleeding and I was getting blood cough. So I immediately sought medical help. I went to the nearby hospital emergency, told them about the scenario, and they quickly checked my blood pressure once again to rule out any kind of blood pressure related anomaly. When they saw that the blood pressure was fine, they called for an ENT specialist because they were thinking that it could be some local injury in the nose. The ENT specialist came. He gave me some immediate medication and nose drop to stop the bleeding, and also did blood tests for bleeding time, clotting time, and other blood coagulation parameter to discard any kind of bleeding disorder. After 2 to 3 hours, the bleeding stopped, and I went back to the ENT specialist for the checkup. He took a probe and checked inside my nostrils and figured out my left nostril was bleeding. So he found that there is a small injury. Because of the injury, I was getting the bleeding. So he told me to continue medication and also told me to be on rest, not to do any kind of exercises, and especially not to lift any kind of weight, at least for 5 to 6 days. If the bleeding stops, everything is fine, but if I get recurrent or frequent nose bleeding, then definitely I have to be scanned for any other possible damages. Thankfully, things are fine for now, but I still am confused at what actually caused that kind of bleeding, because I still do not remember that I was pricking my nose too much that caused any kind of scratch there. Anyway, I do not know. I mean, I had to get back to exercises, especially weight training, to build up my muscles and for the weight gaining and to keep rheumatic pain at bay. But if you or anyone of your family get this kind of an issue, please do check the blood pressure first, because there is any chance of high blood pressure. Get your blood pressure medication, or get the patient the blood pressure medication, and seek immediate medical help, because this could lead to a bleeding stroke like my mother. And the faster you take the action, the faster you can prevent any stroke related damages. So please don't just Google and sit back. Do take some fast action, because the faster you take the action, the faster you can prevent any kind of